I would say a clinical associate is a mid-level healthcare worker.
Clinical associates are based at district hospitals, which are most of the time in rural areas.
I think of it in such a way where we'd be in the forefront of the primary healthcare and district areas, whereby you attack the masses basically at the very beginning, whereby we treat the conditions, the main things that are happening.
Clinical associates, what you do is not really defined as a strict logic thing that today I'm going to see patient 1, 2, 3, 4, 5. It really depends on the institute and your allocation within that institute.
Clinical associates are university-trained medical professionals who work primarily at district hospitals throughout South Africa. They are a vital part of the clinical team working under the supervision of doctors to provide medical services ranging from taking patient histories and performing routine examinations to providing emergency care for acute conditions and managing chronic diseases such as hypertension, diabetes, and HIV/AIDS. They will have a huge impact in rural areas of the country where we have a serious lack of trained health professionals.
We review the patients, okay? We review patients who have chronics, your normal chronics like hypertension, diabetes, re-prescribing their prescriptions and modifying if there needs to be adjustment.
So you cut them at the very beginning where with quality, ensuring patient education, seeing them, treating them, then the doctors in the hospitals basically have less to see.
We do procedures as well. A lot of patients come in, with fractures. We do POPs, we reduce. A lot of patients come in with abscesses, so we do incisions and biopsies. We do investigations. It's a broad thing that we do. That requires, a lot of skill and knowledge, which we have and we've been taught adequately.
I assist in the cesarean sections. I'm also responsible for doing the dilatation and curettage in Ward 3 in the gynae ward. And I also do ultrasounds for the gynae patients and some of the obstetric patients.
We see acute cases, changes in conditions, like patients who had these chronics but develop a new condition, and then we assess that and admit if need to be admitted or investigate further and treat accordingly.
Clinical associates are required to earn a Bachelor of Clinical Medical Practice to qualify for registration with the Health Professions Council of South Africa. Rooted in problem-based learning, this 3-year course of study emphasizes the acquisition of hands-on clinical skills that clinical associates need to take their place as essential members of district-level care teams. The rigorous curriculum is competency-based. It prepares students to provide any medical service within their scope of practice that is delegated to them by their supervising medical practitioner.
Studying the Bachelor of Clinical Medical Practice degree during the 3 years has been it's been okay, but it's also been intense at the same time because we had to learn a lot, we had to grow, we had to mature quite a lot within those 3 years.
Being introduced into medicine and it being enforced and it being, but in such a short period of time, so much knowledge, it was really much a challenge. But we coped, we were inspired because we wanted to study and we wanted to complete it and make our parents proud by being pioneers. So we did make it through, but we had a lot of sleepless nights studying and trying to absorb everything in one go.
There was also a lot of traveling, which meant that we had to adjust to different areas, different clinical settings also very quickly because there's great differences between a super rural area and an urban area like Johannesburg would be Para or anywhere else.
And also to do the clinical, like hands-on from first year, taking the bloods, starting to get to know the procedures and actually doing them. So it's a different type of learning, but it was a good experience.
Colleagues of ours went to the US and to Tanzania and looked at a number of other countries that were involved in training mid-level medical workers and said, what is the kind of person we need in South Africa?
And we didn't make anything up. I don't think South Africa just said, let's just make a mid-level care worker, It's been happening in America, it's been happening in Zambia, the other places, Uganda, Tanzania. So for me, it's a matter of, okay, just we need to think as South Africa, how can it work for us?
There was a question around the difference between a clinical associate and a nurse. One of the things that's quite problematic is when people sometimes talk about the clinical associate being between a doctor and a nurse. And that's problematic in a number of ways. One of the major ways is that there's a complete misunderstanding of the relationship between doctors and nurses. Because doctors are not above nurses. It's not a rank in terms of that. We are separate professions with our own domains. We are trained separately with a completely different understanding. So we're there together and we work alongside. So the clinical associates, it's not this, doctor, nurse, and here's the clinical associate. Nurses have their own mid-level workers. So for doctors, then there's the clinical associate. And the reason we called it, when we set up the program, there was a long debate around the name. Should they be clinical assistants or clinical associates, whatever? And the reason that they called clinical associates, we wanted to bring that idea, that's an associated role. It's not an assistant, it's not somebody who's working for a doctor. It's working alongside, supporting with a doctor, associated with the doctor.
Victor is the first one, but we appreciate him a lot. And we like other children to know about the course because we see the importance of it.
Clinical associates are a different cadre of healthcare professionals. They're not replacing any existing professionals, but they are forming part of the already their system to sort of, it's a teamwork.
A clinical associate in all times works best in a team effort, in a team spirit kind of environment.
Many rural areas in South Africa and district hospitals have a shortage of doctors and trained health professionals. Clinical associates will relieve the burden on doctors and can aid primary health care by spending time with patients, doing patient histories, dealing with chronic illness, performing minor clinical procedures and doing investigative work.
And it's interesting, in many of the debates, the one group of people who have never once questioned the program and have always supported it are rural doctors. Who've all along said this is what we need.
Since our arrival here, the time period has been decreased. More patients are seen at a shorter period of time. And I think this has been that dramatic change since our arrival.
I'm writing out a prescription because this is the hypertension cardiac clinic. But due to a circular that went around, as clinical associates have to be countersigned, I have to wait, patients have to wait as well, and then the doctor has to come and countersign. So it's very difficult because you feel like a burden. They have to wait longer, when they're excited that, okay, someone is here, they can just see us and go. And then telling them that, okay, we have to wait, I still need to go get a counter signature. It's just a bit much.
Unfortunately, that is a legal loophole. No one has ever suggested that they can't prescribe. It's in the HPCSA regulations when they instituted it as a profession that they can prescribe. So it's a matter of just time to work through the legislative procedures.
At the moment, clinical associates are required to get a counter signature for any prescription that they write. This is expected to change in the near future and will be a great help to the patient care in district hospitals.
Prescribing right now is a problem because there's some legislative issue around it. Apparently the Pharmaceutical Council has issued out a memorandum saying that pharmacists should not dispense prescriptions that have been written by clinical associates. Instead, they have to be countersigned for by a medical doctor. So that's a problem. That's been a problem for some people. So right now, what we're doing, prescriptions are supposed to be countersigned for until this legislative issue has been sorted out.
Clinical associates will have a great impact in improving healthcare in South Africa if they are supported, guided, and allowed to assist in areas where the district hospitals most need them, such as outpatient departments, inpatient wards, emergency units, and many more. Some examples of how a clinical associate can help in your hospital are obtaining patient histories, performing physical exams, ordering diagnostic or therapeutic procedures, interpreting findings and diagnosing common emergency conditions, developing and implementing a treatment plan, monitoring efficacy of therapeutic interventions, assisting with surgeries, providing patient education and counseling, making appropriate referrals for specialized care.
I think it's what you do in the hospital, no matter where you are. The patients give you that response that, okay, I'll continue doing what I do.
You don't need any material to smile to a patient. A smile is one thing that can cure a patient. It makes a patient feel good. Just by smiling, you will make a day of a patient.
Clinical associates are definitely a groundbreaking career.
And there are a lot of communities that need us, and different skills, not necessarily just being general, but specialities I think are going to be needed in the future, and clinical associates are going to be part of it, definitely.